Hi, welcome to the St. Genevieve Hospital Women's Health Fair. We're really excited to be here today. We hope next year we get to see you in person, but I'm Mary Crecilius and this is Debbie Rainey. And we're the nurse practitioners that provide genetic testing at St. Genevieve Hospital. It's our favorite thing to talk about and we wanted to introduce it to you. So Debbie, how would I go about finding about genetic testing?
So you can come in for an appointment, or you can call either Mary or I, and we can set you up with a really brief survey that will determine, are you a candidate for genetic counseling or testing. It's a really quick survey done on a tablet. We can give this to you. We can either do it over the phone or in person, and we'll be happy to help you.
But Debbie, I'm kind of scared. Like, I have this strong family history of cancer, and why do I really even want to know about it? I'm just afraid. I don't want to get cancer.
So that's a really good question. And the benefits of genetic testing, we can determine, are you at an increased risk? And if we determine that you are at an increased risk, we start surveying earlier, and maybe we can prevent or catch it very, very early when it's more treatable.
But Debbie, like, does it hurt? How do you do it?
It does not hurt. It's a simple blood test. We do it there in the office. You don't have to go to the lab most times. So it's done really quickly in the office during the appointment.
And does it help my family?
It does help your family. That's a good question. So if you're determined or found to have a genetic change, then we know that maybe your family is also going to have that change. And so we also test them. We talk about who would be the most appropriate to test and go from there.
But I'm really afraid to find this information out because I'm afraid the insurance company isn't going to give me insurance if I have something like this.
Right. That's a concern for a lot of people, and there are acts in place to prevent you from being discriminated against should there be any kind of problems with insurance. They'll protect you from being declined.
Well, that's good to know. I'm feeling a little bit better about it. And so what are some things that might indicate that I might be at risk for a hereditary cancer?
So things we look for are cancer at an early age, below the age of 50, for multiple cancers in a family, going down generations.
Are there certain cancers that are more of a red flag than other cancers?
Yes, there are. So breast cancer, ovarian cancer, colon cancer are a few of the cancers we look for, maybe prostate, pancreatic. There's several, but those are the most common.
Oh, well, that's really interesting to know. I'm feeling better about it.
Good.
And, you know, here at St. Genevieve Hospital, we are really lucky to have a genetics program. And there are very few genetic counselors, and it's really hard to get into them in bigger communities like St. Louis or Cape Girardeau. We really pride ourselves on being able to provide a very personalized appointment and quick access to us. And it shouldn't be a scary appointment. Again, our goal is to help people live the healthiest lives possible and to prevent cancer in families. So if you have any questions at all or you're interested in having an appointment, and one thing we didn't mention is often this appointment does not have a copay. It's considered a preventive visit, and the testing cost is often zero. Our average cost that our patients pay for a blood test is $90, and so I feel like we can get a lot of important information at a very reasonable fee and in a timely manner. So we really look forward to seeing you, and you can even call and just ask us questions. We can run the risk assessment before your appointment, and we can determine if you're a candidate for the genetic testing.
Thank you so much for your attention today. We hope to see you soon, and if you have any questions, please feel free to give us a call. Thank you.
We look forward to seeing you.